Now the suffocation. We start with the specific asphyxia, that is suffocation. Suffocation is defined as the mechanical obstruction to the passage of air into the respiratory tract by means other than constriction of neck and drowning. So that means the entry of air into the respiratory tract is blocked at the nose and the mouth level, not at the neck or drowning. So it is the mechanical obstruction at the level of orifices. And this is said as the purest form of asphyxia because there is complete blockage. Because we know that air into the lungs can only enter from nose and the mouth. And when these two are blocked, air cannot enter. So this is the pure form of asphyxia, and this results rapidly into a painless loss of consciousness. The person becomes immediately powerless, unconscious, which is followed by death. The types are, it can be smoothing and it can be overlaying. The occlusion can This occlusion can be achieved by gagging, by choking, and by burking. Burking is another phenomenon I'll discuss. Now, smoothing. This is the closing of air passages, that is the nose and the mouth, either by hands or by any other soft material, And overlaying, this occurs in small children. They are overlaid by someone who is sleeping by the side, either the mother or the father or anybody who is sleeping by the side and is overlaid. Now the occurrence is accidental, suicidal or homicidal. This is most commonly accidental in overlaying. We have seen the cord death in infants due to prone position also, the burial of face in the soft pillow, or accidentally covering their face with the plastic bag, and also in epileptic. So in these situations, it is accidental blockage of the external respiratory orifices. Suicidal is uncommon, and homicidal, it in adults is impossible, but it can only be done in feeble and weak or intoxicated individuals. What is the mechanism of death? Either it is hypoxia, that means reduced supply of oxygen, or anoxia, that is complete blockage. Now we'll discuss in detail the smoothing. Smoothing is a form of asphyxial death caused by mechanical occlusion of the external respiratory orifices or passages, that is mouth and nose. And the nose and the mouth by hand, by cloth, by plastic bag or any other material. So basically the entry of air into the lung is blocked at the nose and the mouth level. And this can be achieved by any means. And what will be the autopsy finding? There are specific pathological findings at the locus. That means the occlusion is at the mouth and nose, so the finding will be limited here. So specific pathological finding here will be abrasions and bruises, which are generally seen in mouth and nose. And they may be absent if the soft material is used or some cloth has been applied. Injuries on the inside of the lips because of the pressure against the teeth, bruising of the gums can be seen. So autopsy, when you perform, you should open up the mouth, lift up the lips. You should see the inside of the lips and the gum for these injuries. and these injuries can commonly be missed if you do not examine the mouth. So this is a picture of a homicidal smoothing and the injuries produced as a result of struggling, and therefore they may be absent in infant because they are weak, they are feeble, in young children, in aged, and in debilitated person because there is no resistance. The air passages often contain blood-tinged fluid because when there is hyperemia, there is congestion, there is rupture of blood vessels, there is secretion of mucus, and this mucus is mixed up with the blood, and these blood-tinged fluid will be found in the respiratory passages. Now, regarding the non-pathological, non-specific finding pathological, we have discussed in the previous lecture. They are cyanosis, congestion, petechial hemorrhages, fluidity of the blood. They will all be present on the skin and on the internal viscera. These are the petechial hemorrhages. Now, we'll discuss the smoothing by plastic bags. The incidence of accidental obstruction of the air passages by the plastic bags is increased recently. The moisture, it seals the respiratory orifices by the plastic. When the children accidentally cover their face, and with the moisture of the breath, it clings up. It sticks to the face and the orifices, and the orifices gets blocked. And the material, which is glue-like material, will be detected in the blood and the liver when you examine them. Now, regarding the medical legal aspects, smoothing is mostly accidental. It may occur in alcoholics who roll over and bury their face in the pillow or in the bed. Or epileptics may also bury their face during the fit and can also suffocate them with some suffocating material. Then at birth, sometimes the newborn may die from smoothing if they are born with membranes covering their nose and mouth, and that is called as caul birth. And the alcoholics who roll over and bury their face in the pillow when they are in bed. Now the overlaying. Overlaying is an accidental smoothing of a child due to mother or any other person rolling over it during sleep and thereby asphyxiating the child. And sometimes it occurs when the inexperienced girl presses the child too closely to the breast and while feeding, and the neonate gets suffocated. And sometimes there is homicidal smoothing, which can be committed by closing the mouth and nostril with hands, and it may also be committed with pillow or any other cloth. It is common method of infanticide. Homicidal smoothing in adults is difficult unless they are weak or they are stupefied with the drugs. Now, burking. What is burking? This is a form of asphyxia which was invented by two murderers, Brooke and Hare. And they used to kill their victims and sell their bodies for dissection to Edinburgh Medical School. The Brooke used to sit on the chest of inebriated victim, alcoholic, drunken, and Hare used to cover with one hand the mouth and the nostril and pushing the jaw with the other hand. So it is a mixed traumatic asphyxia when the Brooke used to sit on the chest and chest was unable to move, and the other guy used to block the nose and the mouth, and that is smoothing. So it is a mixed smoothing and stampede. And sometimes they used to drag like a wheelbarrow, just mimicking a road traffic accident just to disguise the scene. And this method is a mixed example of smothering and traumatic asphyxia. Now, what are the internal respiratory obstruction? There are two types: choking and gagging. Choking. Choking is a form of asphyxia which is caused by mechanical occlusion within the air passages by some solid object. That is inhalation of some solid object into the respiratory passages. And this object excites violent coughing to get it out. But when this is unsuccessful in expelling that object, then the choking results. And this is important. The size of the object is not important, because even a small object, when it touches the lumen of the respiratory passages, it will excite intense spasm of the vocal cords, and fatal consequences will result. In epileptics, the tongue may fall back against the posterior pharyngeal wall during the attack,